Hi everyone, and welcome back to my channel. My name's Sophie, and this channel is chronicling my journey of living my best life with multiple chronic health conditions. Today I want to give you all an update as to how my last few appointments have gone. I had a hearing assessment because I've been needing to turn up the volume more on my computer and in the car. And while my hearing is still within normal limits, the doctor did say that it's very possible that it used to be better and I'm just noticing the difference. So nothing needed in terms of follow-up. She says it's more a processing issue versus a hearing issue, and that it's actually common to start in the 30s, which never knew. So if you're out there and you're in your 30s and things are a little harder to hear, apparently that's completely normal. So I've just continued to turn the volume up, use headsets, and closed captioning, stuff like that. She said that's what she does also, and she's probably around my age or maybe a little older. My second appointment was at the hematologist because of my likely pathogenic variant 4 antithrombin 3 deficiency. He is a fellow. Initially, he didn't seem to think I had it because normally antithrombin 3 is the one with the most burden. The people that have the most blood clots, the most serious blood clots, it's more serious than other clotting disorders. And I've only had the clots after my surgery back in 2021. He went to talk to his attending, and they decided the best course of action would be to test my antithrombin 3 antigen again, because when it was tested previously, I was on Eliquis and it can mess up the reading. They only ordered the antigen, so I had messaged them asking them to also order the activity because Eliquis increases the activity. So if you have antithrombin 3 deficiency and you're on Eliquis, your activity can look normal because of how Eliquis reacts and how the activity is tested for. The antigen has not come back yet, but the activity has, and it is low. So I am exhibiting antithrombin 3 deficiency testing results. It's not super low, but it's not normal either. I'm sure they're waiting for the antigen to come back before contacting me, but they did say that if it did come back low, they would need to talk to my vascular specialist because the fibromuscular dysplasia carries an increased risk of arterial dissections. And if you have a dissection, which is basically where you get a tear or a rip in one of your arteries, you obviously want to be able to clot. But if you're on a blood thinner like Eliquis to manage antithrombin 3 deficiency, you will not clot as well. And depending on where that dissection happens, it can be fatal. That is a conversation they're going to have with the vascular specialist to see what she's comfortable with, and then obviously a conversation with me to know what I'm comfortable with, because I'm the one living in the body. I haven't really thought about it that much because I had my appointment in Philadelphia at the Mitochondrial Center, so things have just sort of been one after the other. But it is something I am going to have to think about because it is something that's going to have to be discussed. The last appointment, well, 2 appointments I had in Philadelphia at the Mitochondrial Disease Center. First was physical therapy, which is a horrible idea when you have trouble with exercise to have physical therapy evaluation and then have a medical appointment. It is not ideal. Originally, I had scheduled the appointment on day 1 and the physical therapy on day 2, which was also not ideal. They called and asked if I wanted everything moved to one day, and that option put physical therapy in front of the appointment. So that's what I did. It was different this time as I did drive myself and I went up the day of. So I drove there and then had the physical therapy evaluation, which also is not ideal, though it does show a realistic day in the life of what my muscles are like after having to drive and use the steering wheel and the gas pedal and the brake and all of that stuff. So in terms of the physical therapy eval, I have to refer to my notes. On the positive side, my gross motor control and fine motor control were both normal. Last time my fine motor control was very, very poor. It was over 4 standard deviations below where I should have been, and it was normal this time, so it was a little low but within the normal range. It was less than it was greater than, it was not 2 standard deviations or more than that, like 3, 4, or 5. It wasn't as low as it was last time. I also did a little better in the 6-minute walk test by 14 feet apparently, but it's still over 5 standard deviations below the norm, so it's basically a wash. My strength actually improved on my biceps and my wrist extensors. My ankle dorsiflexion stayed the same, but again, all of it's kind of a moot point because all of it's 3 or more standard deviations below where it's supposed to be. My hip flexors were very poor. I'm assuming that was from the drive. I do use cruise control, so I don't have to be manually pressing on the gas the whole time because that makes my quads burn. But yes, hip flexion strength was much worse. It was within the normal standard deviations last time. It went from 1.92 standard deviations below the mean to 4.7 standard deviations below the mean. And then in terms of repetitions and strength decline, my hip flexors in July, the strength in 6 reps decreased by 12.9%, and this time decreased by 33.3%, so almost 3 times the decline in strength after 6 repetitions. And then the biceps was 11% decline and is now 13% decline, so decline there as well. And then lastly, my balance is still horrible with my eyes closed on a single leg, so that is something I am going to attempt to work on. I have a lot of things that I can use for balance in my unit. I have like a foam mat, I have a wobble board, I have a slack board. So I have a lot of things that I can use for balance training. Then after the physical therapy appointment, I had the medical appointment, which was difficult. It was difficult to form coherent sentences. I was just so exhausted, so sleepy. The doctor even commented that normally they don't have their patients do physical therapy first because that's gonna happen. But like I said, it is what it is. As I've said before, the genetic testing was negative. They didn't really find out anything more about the 3rd genetic variant I had that was a variant of unknown significance, so that's a to be determined. Then we talked about the biopsy. They did order the biopsy, so the biopsy will eventually happen. I think they're going to contact me. It's going to be done at the University of Pennsylvania, which is right next door. And if I don't hear from them, I do have a number to call. The after visit instructions makes it sound like I'm supposed to call, but in the appointment I was told they would call me. So I'll probably give it a couple weeks, maybe till after the holidays. And if I haven't heard from them, give them a call. It also lists what test they ordered. and they ordered a really good array of tests. It'll test regular like light microscopy, and then apparently if things are abnormal they do electron microscopy. I am going to advocate for them to do electron microscopy regardless, since my cardiac biopsy was already normal with electron microscopy, but we'll see how that goes. They also ordered enzymatic testing and DNA testing, just lots and lots of testing. So I really should be excited about this, but I'm not. I'm not going to say I'm dreading it, but I'm just tired of having to prove that something is wrong and I need help. I have tons and tons of tests showing that something is wrong, but somehow that's not correlating to me getting any help. I'm just tired of having to jump through hoops, is what it boils down through. But I don't really have any other options, so that's what's going to happen. Other than that, I do have lots of other blood work to discuss in maybe the next video, maybe the one following that. Waiting for some of it to come back. I do have my yearly appointment with my primary care doctor coming up on the 16th. So I'll probably wait until after then to do the blood work update. Hopefully everything will be back by then. So next week will probably just be a more general update as to how things are going. Maybe a mental health update. I don't think I've done one of those in a while. But probably will record it after this one, since I am in the go recording, which is not always something I can do. I apologize for the length of this video, but whenever I go to Philadelphia there is a lot to talk about, so the videos are longer. And I think that's going to be it for this one, because it's long enough as it is. Anyway, I hope you guys are having a great day whenever it is you are seeing this, and I will talk to you in the next one. Bye guys.